So our next session is about a very important topic. We're going to be diving into the topic of digital health data, and we've got two experts in that field joining us now. Ready? Come on out. We've got Huda Idrees, the founder of Health, and Franck Baudino, the founder of H4D. Now, both of you are working really at the forefront of technology and medical data and health. Could you each, just for the audience, briefly explain what your organizations do, and then we'll start the conversation?
Sure. Yeah. So like Melissa said, my name is Huda. I run a company called Health. We build a real-time health data platform that helps hospitals, labs, pharmacies, any healthcare provider securely exchange personal health information with individuals, so with patients, their families, et cetera. So we're available across Canada right now, except Quebec, because we're not bilingual, so it's funny that I'm here in Monaco, which is a largely French-speaking country. We're not bilingual yet, but yeah, that's what we do.
Great. Frank.
Good afternoon. My name is Franck. I'm a medical doctor, and I run a company specialized in telemedicine, which is called H4D, and we have invented the first connected medical office. But apart from the technology, our value proposition includes the training of the physician, so it's an end-to-end solution. And our topic is to answer the question of access to health for population at large. So what we do today is to implement this end-to-end solution where people work, so we have big corporate clients, where people live, and where people go.
Some of you may have seen the H4D booth out in the interactive area. Did any of you get to experiment with that or go inside of it? Anybody? Okay, we've got a couple people. I still want to go out there and do it. But so, Frank, I'd like to start with you when it comes to your work around data. Now, obviously, any industry that is doing something digital, which that's almost nearly every industry these days, the issue of privacy is a concern, no matter what. But you're actually looking at privacy and security from a little bit of a different angle. Can you tell the audience about that?
Yes, privacy is, everybody is concerned about that. And for me, it's very important in digital medicine to distinguish the e-health sector and the telemedicine sector. Those two sectors are completely different. If I could say the e-health sector is like a jungle, because you can buy sensors in store and nobody knows what happened with the personal medical data sometimes. And telemedicine, it's completely different. Telemedicine is medicine, and it's a regulatory sector, so everything is encrypted. You need to identify the physician, you need to identify the patient, and all the medical data are stored in professional medical databases. So privacy, it's completely part of what we do.
So telemedicine sounds like it's very monitored.
Yes,
correct?
it is. Yeah.
And that you have to identify, you said, the physician and the patients and get all of that data.
It's a professional
available.
sector.
Yeah. But when it comes to e-health is much broader too, isn't it? You mentioned sensors and being able to, anybody getting their hands on that data. How is it even possible that if I swallow a pill that has a sensor on it so it can scan my organs? So I wrote a story about that once. That's why I know about it. But so how is it possible that possibly anybody could get their hands on that data?
This is another thing. This is another thing. When you...
or any kind of sensor, not necessarily that.
No, because it's very important. It's very important because when you eat something, it's becoming a medical device class 3, if it's a kind of sensors. Okay, so this is typically medical devices, so this is a professional sector, and you are submitting to very particular rules, which is completely different. I think one of the biggest problems, sorry if it's not exactly what you asked, but for me it's very important to talk about this. Words have sense. And today, the big problem we have is that for the same word, we talk about very different things. So for the consumer, it's not easy to understand what we are talking about. But when you talk about telemedicine, it's medicine, it's for professional.
Got it. Got it. Okay.
I think health in general, like lots of different industries, hasn't adopted technology in the same way. Or as quickly as a lot of us would have expected. And something that goes with it is we also don't have common vocabulary. So it's difficult for people to understand, how telemedicine is different for them versus something like their sensor data. And I think it comes back to the point of, what do we know about our own health information, who is using it, who is owning it, where it lives right now, so where it's hosted. A lot of that is, we actually have to build a lot of awareness as health technology entrepreneurs. And so Franck's company, I can imagine, is doing a lot of that work to say, this actually is this is the service you're getting, and this is why your data is secure and private, et cetera. That's a lot of the work we have to do at DOT as well.
Yeah, so speaking of what you do at DOT, in addition to starting to drive that awareness for patients on where their health data is going, what it's being used for, how do you actually make sure it's secure? Where are you putting it? And how has your relationship with health practitioners evolved as a result of what you're doing with health data?
Yeah, so I'm sure all of you have, the parallel I like to use with what DOT Health is trying to build is I'm sure a lot of you have tapped your credit card to pay for a cup of coffee. Everybody? Yes, maybe? So what's happening in the background there, even though it's a millisecond transaction, is really magic. There's transactions that are happening in the background you know nothing about, where very quickly data is being exchanged. When you think about how that works, for example, for a lab test that you got done at a lab, and now the doctor needs that information, usually that information is sent via paper mail or fax, or some outdated technology. So DOT is replacing a lot of that paper-based trail with a digital feed. And so often the questions we'll get is, how do we know that it's secure? I think privacy in general, so many other industries have solved for a lot of the concerns already. So we don't think twice before banking online. Everybody banks online, you log in on your phone, it's okay. Then how is it that it would be any different when it comes to your own health information? So we've seen really a lot of interest from typically younger healthcare professionals. So the average age of a doctor in Canada right now is 55. So that's a problem for us. But what that means is they're not open to a lot to change. So we're seeing some pushback from people who are older, but usually for younger healthcare providers, it's a no-brainer.
And where do you think this is all going? So in America, people refer to the innovation in Silicon Valley and in other startup ecosystems as the wild, wild west in many ways. Is health any different? Is it just kind of happening? Is it happening really quickly? Is it happening too fast? What do you think we have to look forward to?
I mean, I don't think it's happening fast enough.
Yeah.
No, I think so.
Yeah.
No, they are very good on communication, and they do a lot of research and development. On my field, we talk a lot about artificial intelligence and a new kind of humanity. I talked about this 2 weeks ago in Silicon Valley. So, but the reality, I think, it's to know what people expect. We can talk a lot about the future, etc., and I think it will be the purpose in a few minutes. It's very important to share a vision. And there are big differences between how Americans think the future and how in Europe we think about it. And the privacy of the data is part of the difference. Apart from that, we don't have the same healthcare system. In Europe, it's a very sharing system, mutualist system. In the USA, it's completely private, and the sense of the privacy, it's not the same also. So it's a kind of politics question.
Yeah.
But I think even though it is the wild, wild west in the United States, a lot of technologies have not seen a lot of uptake from the consumers. And I think we need to think critically about why that is. So healthcare is a lot more personal for us than some of the other, your photo sharing app is not, you don't think twice about it because it's not so personal, the information that's on it, perhaps. But when it comes to your health and your health care and delivering it, it's a lot more, the stakes become higher. Mm-hmm. And I think that's why we haven't seen as big mass market penetration. On the other side of it, hospitals and healthcare has been around for such a long time that the processes in which they work have been the same for decades, for centuries. So, when you try to do something small, like, hey, doctor, instead of receiving a fax, do you want to receive maybe, a digital email? And they're like, whoa, we don't know if email is secure. So the questions that we're answering and the awareness that we're building is a lot more basic level than some of the other industries.
So what do you do when in your case, you're working mainly with consumers, but are you also working with healthcare practitioners?
Yes, we are. So the way it works is any healthcare provider, so it could be a hospital or a lab or an imaging facility, et cetera, can be part of the .health network. And then what that benefits is when individuals like you and I will sign up for the service, they can request information from all of the people on our network. So we basically have this two-sided network. And what's amazing is we never hear the privacy question from the users. So individuals are hungry to get access to digital healthcare, to their own information, to be empowered by their own data. So the biggest questions we're fielding really is from the provider's end or from the hospital's end instead, which I think also shows that sometimes when we talk about privacy, the motivations are very different than what they seem.
Yes, I completely do agree with you because we never have this question before, When people know that we are here to take care of them and to offer them a new way to access to health, they know and they suppose that privacy is one of our priority. And it's the base of the offer, in fact. What do they expect? It's to be treated. So they are ready to share the medical information with physician if it's needed.
Mm-hmm. And you were talking earlier about the benefits did we touch on the benefits for physicians and for patients through telemedicine and through what you're doing? But what is the larger vision? I know that's something that you wanted to share.
Yes. The first thing, the benefits for sure is for the patient and for the physician. But globally, what we do and what we can imagine for the future, it's the public health benefits. It's exactly what I wanted to do when I started and when I created this company. It's to be able to recreate new way to access to health for population at large and to be able to create a new network of physicians. And those medical booths connected together could be the first step for endemic and epidemiological network, which is very important for public health sector, for prevention, etc. For example, for now, we are starting to design a new healthcare pathway on Connected Health City, which is completely new.
Connected Health City.
Yes.
So what does that look like?
It looks like, for example, for tourists, when you arrive in Singapore or in Doha or in other cities we are talking about, it's directly to be able to find this medical point of care and to be directly connected with a physician who understands you, who can speak your language. You're not lost. Mm-hmm. You know directly how to be treated.
Yeah, so do you consider health one segment of smart cities?
Yes,
I don't want to get too much into smart cities, but...
Yes, it's part of this concept, but it's much more than this, because you can have three levels of benefit for the patient, first of all, also for the physician. It's a new way even for the physician to consult and to do a real remote consultation, but also for public sector. Imagine all the data you can collect and what you can do for the personal and collective analysis.
So one question I have, and this is not a very nice question, but one question and concern I've always had around smart cities, and what I mean by smart cities, for those of you who may not know the term, is, for instance, Seoul, Korea, actually that's where I was born, is considered one of the smartest, most digitally connected cities in the world. And I know Singapore is also very connected. And so their transportation, their education, their health is all very digitized and it's connected. But what if the system goes down? What if that hasn't happened yet, but it could, it's online. What if the system goes down? Is that something that people working in health data are thinking about if they want to be actually a part of a healthier, smarter city?
You can go to a classical medical office.
We just become Quakers and move to the forests or something. Yeah.
No, for sure. It's very hard to answer because we can imagine everything. If everything goes down.
Anything could go down, actually.
And it's not specific to smart cities, or it's not specific to health.
It's anything.
You know, when we talk about like, what if if the internet goes down, we're all toast, because so much relies on the internet. If electricity goes down, like, what are you going to do? So I think the backups in this case, but the problem is the backups can't be so arcane. Like, we can't always rely on paper, because then things could flood, and or there could be a fire, and then everything is gone. So I think you have certain levels of backups, and then beyond that, you make sure that you're not, for example, storing, or you don't have single points of failure. So, for example, the way that we set up all of our databases are in microservices architecture. So, for example, we don't store all of your health information in a single data warehouse, because in the event that that goes down, or it's not responsive, or whatever, you can't rely on just a single point of failure to take your entire service down. So we split it up across 12 different ones. And that's what we do when we put together a person's personal health record. It's actually pulling data from 12 different data centers. And that's important. And then we have backups that go for all 12 of them in 12 other locations. And that's one way of doing it, right?
Yeah, absolutely. I've learned the hard way what happens if you don't back up your data.
Yes.
I think we all have at one point or another. So when it comes to being able to empower patients with control of their own health data, or being able to empower physicians and patients with things like your booth that you created with H4D and other telemedicine projects that you might be doing, in order to scale this and go global, is it imperative that governments get involved and they have a say and an input on this, or can the private sector do it themselves?
We do both. We started with private sector because we are the business model. Sorry to talk about this. But no, for example, in France, you have the reimbursement of the telemedicine consultation. And we start to work with the public sector, with government, to implement the solution and to be part of the solution of the remote access or the access to health for remote areas. So it's becoming part of the public sector consideration to know how to promote telemedicine solution.
Okay. Yeah, I think it's important to know our roles. So government's role here is to set policy, set appropriate laws so that citizens are not taken advantage of by private corporations. And then I think it's a private company's job to actually deliver the consumer-facing services. So I think when we get those roles mixed up, there are problems. So governments need to understand that they are not going to be building everything themselves. So private companies need to be able to do this, and they need to work in collaboration in order for this to scale globally.
Right. All right. Well, I'm all in favor of collaboration. We are out of time, so thank you both so much for joining me.
Thank you.
I'm going to welcome Jean back to the stage for our next session. Thank you.